All right, good morning, everyone. How's everyone doing? All right. Thanks so much for having me and giving me this opportunity to speak. Like the introduction said, my name is Benny Chen. I was a recent pediatric emergency fellowship graduate of the University of New Mexico, now practicing at Children's Hospital, Colorado. And since this is medical education and participation is always mandatory, let's start with some easy questions. Show of hands, who has read this book? All right. So the first one I saw was Sarah Dakin. I'm going to start with some tough questions. What happens if you give a mouse a cookie?
He wants a glass of milk.
Perfect. Now, the next question is, what happens if you give a mouse a pot cookie? Well, the answer to that is they might end up in the pediatric emergency department. So today we're going to talk about cannabis and kids and the unintended consequences of marijuana legalization. But to know where we are and where we are headed, we certainly need to go back in time and take a look at where we've been. Our objectives today include a brief history of marijuana legislation, a review of recent New Mexico legislative changes, a review of cannabis effects, and then discuss specifically the pediatric ramifications. This poster here is from a 1935 ad for a anti-marijuana movie, weed with roots in hell, weird orgies and wild parties. And while we know nowadays that things are very, very different given the proliferation and the expanded knowledge of marijuana, at least back then already they knew, hey, not recommended for children, right there in bold. So let's go all the way back in time to 1937. Marijuana was banned, and yes, back then it was spelled with an H. And the Marijuana Tax Act was enacted to prohibit cannabis at the federal level. In 1969, the Marijuana Tax Act was actually briefly struck down by the Supreme Court, and the federal government was able to go back and in a different way ban marijuana with the Controlled Substances Act in 1970. Furthermore, specifically classifying marijuana as a Schedule I drug also made it very difficult to do research. In 1973, Oregon became the first state to decriminalize cannabis, followed by Alaska, California, Colorado, Maine, and Ohio in the following years. In 1978, New Mexico does something pretty cool. It passes the Controlled Substances Therapeutic Research Act, really paving the way for medical marijuana investigation and subsequent legalization, which California tackles in 1996. So a huge gap there. This was followed by a slew of other states. New Mexico didn't legalize marijuana for medical use until 2007. And I believe, since we have some folks here from Illinois, theirs was 2014. 2012 is the big bombshell. Colorado and Washington legalized recreational marijuana, with commercial sales starting soon thereafter. So briefly, and I'll highlight these again as we go through the timeline, but 2012 is a year to keep in mind, all right? And then nothing really happens after 2012 other than Fast and the Furious movie franchise going to make 4, 5, 6, 7, and 8. Wildly entertaining. No, I'm kidding. Actually, as soon as one state, legalizes for recreational use, several more follow suit. So Alaska and Oregon follow in 2014, California, Nevada, Maine, Massachusetts, 2016, Vermont in 2018, Arizona, Montana, South Dakota, and New Jersey in 2020. And then in 2021, New Mexico legalized recreational marijuana, with commercial sales occurring in the following year in 2022. This map might be a couple months outdated, but when I last looked, at least several weeks ago, we're now at a total of 39 states and the District of Columbia for medical legalization, and 21 states and the District of Columbia for recreational legalization. I believe 14 of which are allowing for commercial retail. I'm going to be perfectly honest. I forgot about Guam, Puerto Rico, some of the other territories, so I'm not sure what the status is with those locations. So, cannabis. Let's get into the weeds. It's a plant. Cannabis is its Latin name, derived from a Thracian term from the 6th century. Marijuana, as it's also colloquially known as, well, no one knows really where that word comes from, though there's some fascinating historical, like academic historical fights over the history of the root of that word. Typically, it is consumed either through smoking or now vaping or ingestion. In rare instances, in alcoholic suspensions or in tea concentrates, but those do exist as well. THC is the main psychoactive compound out of 400 compounds in cannabis. Its fancy name is delta-9 tetrahydrocannabinol, and it works on endogenous cannabinoid receptors. THC itself is highly lipid soluble, and it has an affinity for those endocannabinoid receptors, which live in your cortex, your cerebellum, and your basal ganglia. Those three places are important because it kind of explains its affinity for causing alterations in thinking, memory, pleasure, coordination, and movement, right? Those three are the zones that kind of control those things. And so it has been harnessed for a variety of medical uses, as well as a variety of recreational uses as listed above. So these psychoactive properties were already known to ancient Assyrians. That's like 4,000 or 5,000 years ago. And the documentation of those euphoric properties was also listed more than 2,500 years ago in histories, the founding tome of Western literature. But its adverse effects are also really well documented. Now we're going to turn this over to the group. What are some of those adverse effects that come to mind? Feel free to put them in the chat or holler them out.
I'll say apnea and seizures and just altered mental status in young children.
Fantastic. Anybody got anything else?
Abdominal pain, gastric upset.
Absolutely.
I was going to say extreme cyclical vomiting.
Huge reason why we see teenagers coming in.
Standard altered mental status.
Yeah, absolutely.
Temptation.
The cyclical vomiting in the teenage world is called greening out. I didn't know that.
I think the group picked up several of the highlights. I would also like to highlight this very last one, being psychosis. That is the one that is particularly worrisome to me, especially in light of some recent findings. So this is adult data from Denmark, but we can extrapolate certain things, hopefully, to the pediatric population. It was research looking at cannabis-induced psychosis, which is a specific psychiatric diagnosis with its own ICD-10 code. And in the past few years, they've seen a threefold increase in this diagnosis. This appears to be correlated with two things: A, increased availability of cannabis, and also the increased potency of marijuana or cannabis in the past few years. Further studies have looked at what other factors might be at play, and the increased risk of psychosis for the individuals who have family members with schizophrenia is much higher. The study over here on the right is where they had healthy controls versus individuals who had a family member, a nuclear family member with schizophrenia. And as you can see here, in the right column, we have healthy controls. In the left, we have clinically high risk. Everybody got high, sure. But those that had who were healthy controls didn't really have much in the way of paranoia or anxiety, versus those who had relatives with schizophrenia had much greater rates of anxiety and paranoia, with concern for increased risk of psychosis with individuals who had daily or high potency cannabis use. What do you do about cannabis-induced psychosis? Doesn't sound like very much. It's the same thing like Haldol, Ativan, Benadryl. There were discussions about cannabinoid antagonists, like almost like a reversal agent. Apparently some were made a few decades ago, but they had bad psychiatric side effects, so pharmaceutical companies killed those drugs. All right, so those are marijuana's effects, but what about marijuana's effects on children? We all know children are different, right? All adults can take aspirin, but if you give children salicylates, they explode right away, right? Okay, they don't explode, but Ray's syndrome is pretty close and they can die. So children are different. Colorado has some of the most extensive studies on this, and here are a bunch of the listed clinical effects. The most common were drowsiness and lethargy, about 50% of the children. Ataxia and dizziness were about 12%, agitation 8%, vomiting 5%, dystonia 2%. The scary ones are respiratory depression at 2%, hypotension 2%, seizure 3% of these. Now, there's not necessarily a difference in what effects children experience, but what is very different is the effect severity. And this is probably due to dosage of exposure. And we'll get into this a little bit more. A window that conveniently looks directly at how this affects kids versus adults was this case that occurred in San Francisco in 2018. First responders went to a kid's birthday party where, quote, everyone was acting weird. A whole variety of symptoms were found, including dizziness, nausea, vomiting, lethargy, hallucinations, and palpitations. The first responders astutely recognized that, ooh, maybe marijuana was at play, and the suspected marijuana gummies appeared approximately an hour prior. So you have approximate timing. A total of 21 patients, 12 children and 9 adults, were brought in for medical care. And if you read this paper, it's awesome the amount of coordination that they did across 3 different hospitals to ensure that everybody got blood draws and all of that was sent to the same lab so they could get some more data. Now, when they tested the gummies themselves, they contained approximately 2 milligrams of THC in them. For comparison, most commercial units, like a single chocolate square or a single gummy candy now, ranges from 5 to 10 milligrams of THC. So this is a smaller dose. However, they found in the children compared to these 9 adults, they all had higher levels of THC after a similar duration of time. They had more severe symptoms. They had longer duration of hospitalization. And what was notable was several of them had leukocytosis and lactic acidosis. Now, it's hard to say about the longer duration for hospitalization, right? Are we more concerned for the kids, so we watch them longer versus the adults? It's like, man, get out of here. And higher levels of THC, they're smaller, but also what child do you know that only eats one piece of candy and calls it quits, right? So perhaps they had a lot more than the adults. But it gives some insight into how the drug exposure or acute poisoning is very different in children. Now, if we zoom out from the biochemical and clinical changes and take a bird's eye view at policy and at legislative changes, there are a bunch of interesting studies that have come out over the course of the past few decades. Early studies came out from Washington, one of the first states to legalize, but since then, almost all of them have come out from Colorado. Colorado, I think this is in 2016, found a marked increase in the number of exposures for children after legalization of recreational marijuana. More digging shows, at least in 2019 over here, specifically, we're seeing an increase in hospital cases and a continued increase in calls to poison center. So let's see, 2012 right here is when Colorado legalizes recreational marijuana. And then after that, you can see a steady increase in poison center calls, which is the gray bar, and then hospital visits, which is the black bar. Taking a step back and looking further out at nationwide trends, one study showed from 2014 that even in states that had undergone decriminalization, so not recreational marijuana legalization, but simply decriminalization, which oftentimes is part of the pathway towards that, we see a significant rise in the number of cases going up. Nationwide trends show total numbers at a 13-fold increase in hospitalizations over the course of the past few years. And is primarily driven by edible exposures. As you can see here, the vast majority for the young population are driven by edible exposures versus some of the other routes that marijuana is consumed. This is poison center data across the entire country. Now, why are edibles particularly concerning? There was a Canadian study last year from the group out of Toronto Sick Kids. They didn't have any good pictures, so I didn't have anything to share, but it demonstrated a significant increase in the rate of severe intoxication in children, though they did cover 0 to 18 years of age, with edibles being a strong predictor of ICU admissions, which is why edibles certainly make me worry more for clinical severity. So at this point, you're probably wondering, well, why are kids getting sicker? Why is there increased clinical severity? Well, for starters, marijuana itself has become more potent in the last decade. This is data from the University of Mississippi. It is one of the federal government, it is one of the only federal government marijuana plots, I guess. There's a marijuana farm at the University of Mississippi. And so most studies of marijuana from the 70s onwards was using their stock. Their stock itself has gone up in THC content from 4% in 1995 to 12% in 2014. Follow-up studies have taken this out to 2017, and now we're up at 17%. Now, this is government stock. You can bet private growers have far outpaced them in their own, plant strains and potency and their own ingenuity when it comes to breeding marijuana plants. Additionally, novel forms of cannabis have evolved to have higher concentration. These are also known as butter or dab or shatter or wax or oil or resin. I don't know, for fun, clinically, every time I have a kid who has used marijuana, I just ask them for new names, like what are they calling it? And the list goes on and on. But all of these homemade or street-made concentrate products are now showing upwards of 80 to 90% THC by weight. So that is very, very potent stuff. In the early 90s, there's limited literature, but it sounds like the concentration at that time was around 2 to 4%. Even in commercial products, like these packaged gummies here, where you think there's a little bit more regulation, THC concentration in these individual products has doubled in the last decade. Now, something's got to give. With all of this THC concentration going up, a presenter at last year's American College of Medical Toxicology Grand Rounds raised the concern that the CBD content, one of the other common compounds in marijuana, is actually going down. Most concerning about that is that CBD may have some antipsychotic properties. So as we increase the THC levels in this product and increase psychotic properties, the counteracting compound that may temper some of this is being bred out or leached out in the manufacturing process. And this might be making A, the psychosis that we talked about previously, and B, some of the clinical effects worse for the individuals who are poisoned or intoxicated. Well, let's take a look at New Mexico's experiences itself. In this study, we only looked at children between the ages of 0 up to 12 years old because I don't care about teenagers. I'm kidding. It's not that I don't care about teenagers. It's just that once they get a little bit older, they're probably experimenting. And I'm particularly interested in the unintended exposures. So we specifically looked at the younger children here.
And I don't think you could have a graph big enough.
From 1998 to 2021, the New Mexico Poison Center received 269 calls related to marijuana poisoning in children aged 0 to 12. This drop off here in 2021 is from wrapping up data collection. We at UNMH did not magically discover how to curb all these exposures. We just stopped looking at data at that point. But follow-up conversations with the Poison Center demonstrated that in 2021, we did indeed exceed the 2020 count. So no significant changes were seen following Colorado's medical legalization, which occurred in 2000. No significant changes occurred following New Mexico's medical legalization in 2007. But then after 2012, when Colorado legalized recreational marijuana with commercial sales happening in 2014, the numbers explode. The median number of cases before was like 4 calls per year, and after that, it's averaged about 24 and a half calls per year. That's a near linear increase in the rate of calls, like to 10 times the rate prior. During this same period of time, the total number of pediatric calls to the Poison Center for all things, right? Batteries, magnets, quarters, Tide Pods, remember those, everyone? Yeah, that actually declined from 11,000 calls per year to 8,500 calls per year. So that rate of rise is even more dramatic. Of note, during this period of time, the neighboring states, Utah, Arizona, and is part of Oklahoma touch? I don't know. And Texas did not have any legislative changes during this period of time. And so with New Mexico not making any legal changes and Colorado as our neighbor having those legislative changes, we saw a significant change in the number of calls to the Poison Center. Now, the vast majority of cases involved really young kids. Yes, we were looking at the age group 0 up to 12 years of age, but the vast majority of these kids were less than 5 years of age. Most of them were around 2 to 3 years of age, and ingestion was the most common route of exposure, both pre-neighboring legalization in Colorado and post that period. Looking at the pre-post change, the origin of call changed slightly. Most of the calls previously were from private residences, and thereafter, most of them came from healthcare facilities. Luckily, or unluckily, the same number required ICU admission, so that rate stayed stable around 12%. The type of exposure changed dramatically, though, with food and edible sources going from rarely identified to now the most commonly identified source of marijuana poisoning. The 20 times greater likelihood of food exposure in the post-legalization years. I think this neatly reflects what we saw previously, right? Where the increase in pediatric marijuana exposures is predominantly being driven by edible product exposure. The other thing that changed significantly was the severity of effects. Previously, about 16.7% of the exposed children had what was classified as moderate or major effects. In the period after neighboring legalization, 39% of these children were classified with moderate or major effects. And these definitions are set out in standardized definitions used by all Poison Center call centers. This is from the American College of Medical Toxicology, and there's like a whole coding binder for the Poison Center. The management side, like we talked about, didn't change. Approximately 10% were admitted to critical care units. Similar numbers were admitted, slightly higher numbers were admitted to the general pediatrics floor. But for the most part, the vast majority of the children did well and were either discharged from the emergency department right away or after a brief stay. Now, our study had some limitations in that, first off, we're still talking about something that is illegal in the federal government's eye, even though over the course of the past 10 years, we've had a lot more, well, permissibility by states, and the way we think about it is a little bit different. But we suspect that there's some underreporting from families, especially in the early years, right, as this is still an illegal substance. And there might be underreporting from providers as over time, there's increasing comfort with managing marijuana exposures and not necessarily consulting the poison center. And then there were some coding changes in 2013 to help specify edible products. It used to be a catch-all, and now there are more specific terms for describing edible products. And so that might have increased some numbers. Now, why might edibles be particularly problematic other than dosage? Well, for starters, even non-edible things are dangerous for this age group, right? As you recall, most of the children exposed were 2 to 3 years of age. Guess what 2 to 3-year-olds do? They explore the world by putting everything in their mouth, right? Your keys, your lucky penny, marbles, button batteries, everything goes in the mouth and can cause problems. The other thing is, look at this stuff, right? It looks good. It's gummy bears and chocolate bars. It's fruit by the foot. It's cakes and cookies and candies. It's the stuff that children like to eat. In fact, it's indistinguishable from the stuff children like to eat. There are plenty of cases in the New Mexico data set that were actually grandparents watching the kids, not knowing that it was that the candy contained marijuana, and giving it to the kid thinking that it was just a treat. Thirdly, some of our toxic things like our medications or soaps or other things that children can get into don't taste good. We classically worry about things like, ethylene glycol, right? Because it's bright blue and it's sweet, just like an icy or Slurpee, so kids will chug it. Same thing with these. They're oftentimes sweet and palatable to children. They're packaged in a way that parodies well-known brands that are simply cereals and candies. And the companies know how to attract. They might be making fun of it, but they know how to attract children. And we're talking about a population here that's 2 to 3 years old, right? They're not exactly savvy enough to go read the label that says, oh, this product contains 500 milligrams of delta 9 tetrahydrocannabinol. They're going to see Captain Crunch and go right into it. Now, we've tackled this problem before as a society. We came up with child tamper-proof medication bottles so that toddlers would stop guzzling ibuprofen, specifically Advil and its sweet candy coated outside. I mean, I struggle to open some of these bottles now. But there haven't been consistent rules about child-proof packaging to keep them from tampering with these products. Massachusetts, for example, has a rule that when you purchase the product and leave the store, it has to be in a tamper-proof bag. But what happens when they go home? They open the bag and they just put it in the pantry or in the refrigerator or in the freezer. It doesn't stay in a child-proof bag. At least they have rules. Colorado does not have packaging rules. New Mexico barely has packaging rules. In one study examining edible products, even in states with packaging and labeling laws, demonstrates very, very poor compliance. So enforcement might be very problematic. And finally, the failure here, I think, is also with legislating just labeling. That's a pretty limited intervention, right? These kids, again, aren't going to read the sticker. So it's on Well, I think the product makers and or legislative pressure to enforce some other sort of restrictive packaging or some other restrictive policy to try and keep children from getting into these things. And the ingested THC in these children can produce same effects at much lower concentrations given their much smaller size, or the edible ones can produce delayed and prolonged effects compared with inhaled, smoked, vaped THC. And the particular concerning thing is with these very, very young children, they can oftentimes present lethargic, listless, unresponsive, or minimally responsive. And I think with the opioid epidemic in the past few years, that is something that is much more prevalent in our minds, right? That is something that we as emergency medicine folks or school nurses or just lay people are recognizing opioid intoxication or poisoning much better than some of these other substances. And children can show up with very similar presentations, leading to delayed recognition and interventions as folks can chase down the opioid presentation much stronger. The final concern there is sometimes we have mixed products that contain several substances. There are cases of things laced with fentanyl, which can be, quite frankly, lethal to children if it shows up, as initially a marijuana gummy, but it's laced with fentanyl. So in New Mexico, after a year of discussion, recreational marijuana was legalized on April 1st, 2021. There was an additional year to set up taxes and licenses and permitting. And on April 1st, 2022, it was commercially available. For those of you who know Albuquerque, I lived 3 blocks off of Central, which is a very interesting street with 4 cannabis shops, and there were lines starting at 8 p.m. the night before, just waiting for midnight on April 1st to sell this. In the first 16 hours, $2 million in sales occurred of just marijuana products. And then 72 hours later, we had our first mass casualty incident involving marijuana. There were 16 children involved, 3rd graders, all of them. And what came out after the fact was that maybe one child brought a package of candies, like those rainbow belt gummy candies, and the entire package was approximately 500 milligrams, each belt containing approximately 33 milligrams of THC. For comparison, again, the standard dosing recommended by the state of Colorado is 5 to 10 milligrams for an adult. So this is quite a bit of exposure if an individual ate an entire belt. The school teachers and nurses recognized that these kids were acting kind of funny, split them into 2 groups. The sicker ones were placed in the nurse's office, the rest were placed in a classroom. And in total, 16 of them were sick enough to warrant medical evaluation. I don't know how many were in the rest of the kids in the classroom group who might have had some, but just never showed any symptoms. Most severe were 2 kids who were estimated to have eaten like 2 to 3 pieces. Some kids ate 1, some had just a nibble. Some kids knew, some kids apparently didn't know, but thought it tasted funny. And the symptoms range from anxiety, just crying, to listless, pale, vomiting. And so EMS was called. The fire chief showed up as incident command, I guess, and recommended that all of these children be transported. Sounds like there were also a lot of upset parents on scene. And a lot of the parents took their children home. 12 of them were transported, 12 of them were transported on a bus with 3 EMS providers on the bus. and the rest were sent by ambulance to UNM. And those 12 showed up at SRMC, our sister campus. The 2 that were sent to UNMH with medic units had lethargy and vomiting. By the time I saw them at the UNM pediatric emergency department, they had stable vital signs where I'm back at baseline. Just as an aside, apparently one 8-year-old child with bloodshot eyes on the bus kept asking if they could stop at McDonald's every time they drove past one on the way to SRMC. So thankfully everyone did fine. And there were a lot of jokes about stocking the resuscitation bay with Cheetos, but this was potentially a true MCI, right? We had suddenly a whole number of kids with exposure to a potentially toxic substance. Now, they didn't all need to come to the hospital. Most of them did really, really well. But had this been laced with, say, fentanyl, or had this been a different product, we could have had much, much worse outcomes. All this is to say, as an emergency department, we're already seeing more of these cases, right? And now with legalization in a state like New Mexico, these numbers are just going to keep going up. I don't have much to add to that perspective other than that the reminder that THC exposure should always be on your differential for children with altered mental status.
Thanks, Benny. That was absolutely terrific. You know, I guess what I'm very aware of is I'm sitting here sipping from my Grateful Dead cup. Those of us from a certain generation, you know, this is not granddad's pot anymore. This is way different, guys. And I think that one of the real huge concerns is that packaging and kind of that public health. How do we respond to it? You know, it's really, really rare that even with severe ingestions that these are true life-threatening situations, though sometimes they truly are, 1 to 2%, as opposed to another public health and issue, which I'm not speaking for Child Ready, UNM, or Project Echo, but when you look at how we legislate weaponry and guns in particular, and that those truly cause life-threatening injuries at a much higher rate and are now the most common cause of death in kids under 18, we have a hard time legislating that even. So how are we going to legislate something that isn't really that dangerous? I think it really is a tough situation.
I have a question more for what to do out in the community. So, you know, someone that's been drinking, you give them food, it helps bring the alcohol level down a little faster. Does it work the same for marijuana products? I mean, as you said, they all wanted McDonald's. You know, does that actually help with either speeding up or lowering levels, or is it just a side effect of having marijuana and you're hungry when you get the snacks?
So I think much more of the latter. Oftentimes it's just the tincture of time that really helps them along. Now, is there some possible benefit if their exposure was all edible, and then since it's a fat soluble thing, that I don't know, right? Like, you know, if you immediately chase that with fatty food, does it somehow not get broken down? I don't think so. I think at the end of the day, it's just more effect of, I think, the marijuana exposure, and really taking care of these kiddos is just observation and tincture of time.
And I'm presuming that we don't want them to try and vomit, because I know that there are still, especially here in New Mexico, a lot of the Hispanic grandmas are going to be giving them Ipecac and things.
Yeah, I think once it, you know, oftentimes the things that we can try to do oftentimes come with some worse effects, right? You can make the problem all the more terrible. And so I would not necessarily recommend activated charcoal or trying to make them vomit or anything like that. This would be just watch them. But I think one of the things that we can do is spreading the word that this is not a benign exposure. Oftentimes there's this myth that, hey, marijuana doesn't really have toxic effects. Well, I would call seizing and intubation, and seizures occurs in 3% of these children, right, as a potentially toxic effect. So letting folks know that this is not necessarily a benign thing, that this is not marijuana of old, and that people need to be more vigilant with regards to their own products and stash and keeping them out of their children's way, right? And having that conversation with caregivers or babysitters or grandparents as well, or making sure that it is, yes, every kid knows how to like pull the chair and climb up into the cookie jar, but there are things that we can do as adults that should hopefully safeguard children against dangerous things, and those should be enacted as well on an individual basis. But if the public doesn't know to do that, right, if the public isn't aware that this is a highly dangerous substance for children, then they may not act accordingly. And so that awareness message is also something that needs to be pushed out there.
Penny, I totally agree. I think there's a lot of room for advocacy on our part for state legislatures to not only increase educational awareness and to promote educational campaigns, but also safe packaging. Like you said, just seeing them in Ziploc bags or just wrapped in plastic wrap. It's really it's really unbelievable just how potent they are and just how easy they are for kids to get into.
Yeah, and not to beat a dead horse, but it's that whole packaging thing. The pretending that this isn't being directly marketed to our children or grandchildren is ridiculous. It's fine. If you're going to say that this went from being Schedule 1 drug 45, 50 years ago to something that is legal to sell, it wasn't that long ago that in New Mexico, we still had blue laws. You couldn't sell alcohol on Sundays until after church let out or, something like that. I think there is the ability to legislate packaging much more strongly than is currently in effect.
I know that there is some work being done by the New Mexico Poison Control Center to help families realize, that we do need to keep this product away from the kids. So in the chat box, there's a link to their safely storing cannabis material that you can print and keep available in your centers or on your EMS rigs, if that's a place where we can actually be out in the community getting them this information. So I know that there's other states that have other things going on as well. So check your local community poison control centers for more information too.
And I think an interesting discussion point is also, seeing so many folks from our CART team represented, that certainly brings up the idea that, well, is this a dangerous situation? And I personally have a very hard time with that because we have lots of children who are exposed to grandma's medications, right? And we take care of them medically in a way that does not pull in our child abuse or neglect team because accidents do happen. And so, but then on the other end of the spectrum, we have children who are exposed to meth and fentanyl, and those we certainly call in our child abuse and neglect team. And this sort of sits in a weird intersection, I think, for me, in a state that's already got a overwhelmed child protective services system, right, with minimal resources, but also the need to report adequately in order to gain more resources or to highlight this problem. This is one that I don't have a great answer to. I think I approach each of these in terms of what is the clinical picture, what is the story there, which has flaws right there. But I think we are at an interesting intersection between those two ends of the spectrum, as I see it. Would love to hear folks' thoughts on that.
I think that's an incredible point, but part of the issue, not to put too fine point about it, nationally, if we look at children who are born to mothers who have evidence of substance disuse at the time of a child's birth, it used to be pretty routine nationally to report those to protective services. And really, as we've discovered the amount of bias implicit in those consultations and how racial disparities really kind of reared its head within that, there is really a huge national move, including in New Mexico, where most of the time we don't report. If a child goes into withdrawal, those kids get reported. But if mom just happens to have a finding of it, not necessarily. So, I mean, very germane to what you're pointing out, with a drug that is now legal to be in your home, it's kind of like your teenager being found drunk on your alcohol that you have at home. Is that negligence? Is that child abuse? I don't know. Those are really tough decisions.
So one of the things that I have seen as participating in the child death review team is that sometimes we forget about those pre-hospital providers who have multiple interactions with those family members that we're kind of talking about, where there might be, you know, more than one or two instances of these kids being exposed to this. Is there anything that we can do to provide pre-hospital providers with a mechanism, or what do we do with that information? They're the ones who have it, but unless we ask the good questions when they come to the ED, how do we know that this is their third time bringing that kid in? I don't know. That's just,
I think those situations, well, anyone can report. And certainly, I think this is a really tough question, as Jeff and Benny mentioned, as far as the issue of neglect. But I think with repeated exposures, absolutely, I would make that call, just because whether it's marijuana or fentanyl or something else, those are potentially life-threatening. And sometimes I've had many children, both with marijuana and fentanyl exposures, require ICU level care. Some have required intubation. And I think certainly with repeated incidents, I would recommend reporting, just for nothing else, to try to create a safer home environment for that child.
And, so often, putting on kind of my child abuse hat, one of the limitations as the physician or the medical provider in child abuse evaluations is we don't have any ability to evaluate the home. Our EMS colleagues are right in there. And so I think, on the ED side of things, when we're getting patients from our EMS colleagues, I think really empowering them to share not just the vital signs of the kid, but, hey, what did you see? And recognizing that, especially if they're coming from a rural or tribal community where they may know the families intimately, that no, you guys don't really want to report, but, oh, that's what you're telling us happened, that we pick up the ball and we do the reporting in those situations.
I'd love to hear from some of our pre-hospital providers and see what their thoughts are. Okay, don't everybody talk at once.
I have a question on the Child Fatality Review Board. Are there EMS representatives that sit on that?
Not always. So it wasn't until we were talking about some fentanyl overdoses where I invited Dr. Kim Pruitt to join that panel, and that kind of now she's on a couple of panels, but it really was important when she joined, the information that she brought.
Mhm.
So she had like some very good, this was like 3 runs, or this is what we had with those family interactions prior to that. So they really are key to helping address some of these issues.
Yeah.
And I know it's 9 a.m., Dr. Bullard-Barrett.
Okay, thank you.
Thank you, Dr.
I do
Ganata.
want to thank everybody and at the same time be respectful of time. We'll hang on for a couple of minutes if others have a little bit of discussion they want to do before we go into our debrief. But again, just a huge thank you and shout out to all of our participants over this last now 2 years of this Child Ready Echo program. I find at this stage of my career, this is one of the most meaningful projects that I've ever taken on, and having your involvement is key. So thanks again, Dr. Chen, for bringing this great information to us, and thanks everybody for participating.
Thank you.
And again, please check the chat box. We have CME for nurses, physicians, APPs, and EMSCE link in there. There are 2 different links, so make sure you find your correct link and finish those surveys out. We'll get you some certificates out within 24 to 48 hours.
There's a question in the chat from Kendra, and I don't know, Benny, if you saw that about long-term brain effects with marijuana use.
Gotcha.
I swear I could have been a neurosurgeon. No.
I don't know a ton about that specifically in terms of performance or attention span or cognitive changes, if that's with regards to the changing brain. But the literature that explores the link between cannabis and psychosis certainly alludes to some brain changes, or at least brain chemical changes. Now it's unclear if that's folks who maybe were always going to develop these symptoms later on in life, given their higher risk based off of family history, and that the marijuana usage is just, something that's either accelerating that or not necessarily involved with that. But there is some concern that, especially with psychosis, paranoia, and anxiety components, that there is some link with marijuana and those manifestations. And that's about all I got on that subject.
So it's funny because there are some, and these aren't like, to me, I don't see that they're evidence-based, but there are websites where it's like, oh, if you're having a bad trip on your marijuana, one of the things that they said to do was to take CBD. Is that you could, and I was like, how? I didn't understand. It just said, if all these suggestions fail, and you still find yourself feeling alarmingly uncomfortable, you can always take a little CBD, which is a great compound to combat anxiety and can also be used to counteract an excess of THC.
Okay, I admit it. We do give our hyper little dogs some of the CBD biscuits on a regular basis. Okay, I admit it, but I have no idea. To me, it's like, hey, why not just give them strawberries like in the old days? I've never heard anything about CBD taking the edge off for an acute toxicity.
Like, you guys brought it up in the discussion, so I was just kind of Googling, and it was like, huh, interesting,
Yeah.
All right. Any other questions, comments? Otherwise,
just one last thing for me, and then I'll be quiet and let somebody else talk. So I know that one of the things pre-legalization is that they were talking about the use of medical marijuana for children with seizures. And yet I did hear you say that is actually, seizure can be an effect of a toxic level as well. So are those, how do those relate, or they don't relate, or?
Most of the anti-seizure is non-THC type of marijuana. It's much lower level and more prominent with the different components within it. But again, there still is a lot of debate. You know, I know our current pediatric neurologists here are pretty skeptical of the patients who are failing therapy using marijuana type medications. But I know there are certainly some pediatric neurologists who do support the use. So I don't have any personal expertise. I don't know if anybody else does.
And I just want to address, Kendra wrote, there's lack of understanding that there's a lot of different types of marijuana plants with different chemistry makeup. Absolutely. And I think therein lies the issue, right? With 50 years of banning marijuana and as a Scheduled I drug, it was difficult to even do studies on it. And now we are changing these laws. We are allowing for the use of marijuana without that knowledge, right? And so in terms of biochemistry, in terms of physiology, in terms of all these things that we would like to know more about the plant and about its interactions with people, we're trying to play catch up here, right? We don't have any of that knowledge. We don't know what's going on with this, and yet we're already charging ahead with these laws. And so we're just kind of playing catch up. And I think that gap is where I worry about bad effects for children.
I just wanted to say, I know in my career I was had worked over at Press with pediatric oncology for a while, and there was a lot of talk about marijuana or THC for oncology patients, specifically kids or teenagers. And I know the oncologists were very much against it because of the immunocompromised patients taking a drug or medication that really there is no control of it not causing greater infection with the pesticides and stuff that they use in the oncology patients. Is that something you guys have heard as well, or?
Well, that I did not know about.
You know, I think the bottom line is, you know, in the 70s and 80s pre-ondansetron, yeah, there was a lot more talk about using pot as an anti-nausea medication. I mean, I remember years ago, one of my great aunts visiting with her ovarian cancer and secretly meeting with my oldest brother to get a little pot to handle her nausea, you know. That was, you know, circa 71 or something